The introduction of robotic surgery in the medical field has been a game changer for doctors, and with recent advancements in technology, robotic surgery is becoming more and more popular and beneficial for the patient. In this morning's Ask a Specialist segment, we'll talk about what you need to know with Dr. Joseph Rodriguez, general and robotic surgery physician at the Queens Medical Center. Good morning, Dr. Joseph. So tell us a little bit about what is robotic surgery.
Of course, good morning. So there are different robotic platforms used by different specialties in the world of surgery, including orthopedic, you got neurosurgical specialty, general, cardiothoracic, urologic, and gynecologic specialties. Now, when you say robotic surgery in general surgery, it's the use of the Da Vinci robotic platform, which is currently the most dominant robotic instrumentation here in the US and in the world. So it is a compact, freestanding, mechanized machine that is controlled by the surgeon while sitting in a big console. So just imagine this, Chris. So there's a rectangular, thin, mobile pillar with 4 mechanized arms, and these arms look like the arms in factories that is automated in car machine factories. So it's the same idea, but much smaller and connected to this pillar. And it stands beside the patient, and a console where the surgeon sits, which is situated near the operating table. So it entails creating small incisions in the patient's abdominal cavity or chest and inserting small instruments the diameter of a pencil that is attached to the arms of the robot to perform surgery.
Yes, that's very cool. The future is here. So what are the procedures in general surgery that can be done using these robotics?
Yeah, so most of the general surgery cases that had been done by a laparoscopic approach since the 1980s are now being done with the robot. So this includes inguinal or groin hernias, gallbladder removal, complex hernias of the abdominal wall where you have large defects, colorectal cancer, diverticular disease, even transplant surgery, or any abdominal or thoracic diseases can be approached through robotic surgery.
That's very good and very serious surgery that these are helping out with. So finally, what are some of the advantages of using robotic surgery?
Yeah, so in laparoscopic surgery, or laparoscopic surgery has been here in the 1980s, but we found out that there's some limitations for complex diseases. So one advantage of robotic surgery is the 3-dimensional high-definition view that we can see inside the belly or abdomen and the thoracic cavity. And the instruments, though, it's wristed. So it moves like my wrist or my hand, not like laparoscopic surgery. It's really limited. So complex intra-abdominal thoracic procedures have increased because of this robot. So since the inception of robotic surgery, it's deemed to be a very safe procedure. So when I do my robotic surgery, I found out that there's less narcotic use for patients. So as you know, here in the US, narcotic abuse has been really bad. So when I do my robotic procedures, there's less, or actually not even morphine intake or oxycodone or even Vicodin. People take acetaminophen or ibuprofen. There's less blood loss. It's faster back to work, and there's a less chance for opening up patients with robotic procedures.
Wow, sounds like huge benefits by using robotic surgery. And if you'd like to learn more about Queens Surgical Services Department, you can just visit their website, queens.org. Click on Services, then click on Surgical Services to learn more about robotic surgery revolutionizing the medical industry. And we've been talking with Dr. Joseph Rodriguez with some great information. Thank you so much. You have a wonderful day.
Thank you very much.
It's our pleasure.